Hello, JMIR followers. This is Dr. Jennifer Joe, Chief Ambassador at JMIR. Today, I'm excited to be interviewing Dr. Robert Hirton, Assistant Professor of Medicine at Mount Sinai Hospital.
My name is Robert Hurton. I'm one of the gastroenterologists at Mount Sinai Hospital, and I practice and see patients in our inflammatory bowel disease center here, which is really the area of gastroenterology that I focus on mostly. I'm a physician scientist, so I also do research in inflammatory bowel disease. And one of the areas of research that I've been interested in over the last several years is how we could apply novel technologies like wearable devices to the study of chronic disease. And then when COVID came around a little over a year ago, our group at Mount Sinai had already been working to use these devices in the management of disease and health. And we sort of started to pivot and say, how could we use what we've been doing already and exploring already to kind of address this evolving COVID-19 pandemic?
Dr. Robert Hirton is the lead author on a paper recently published in JMIR. Use of physiological data from a wearable device to identify SARS CoV 2 infection and symptoms and predict COVID 19 diagnosis, an observational study, which was published on February 2nd, 2021 of this year. We know that changes in the autonomic nervous system function, characterized by heart rate variability, have been associated with infection and observed prior to clinical identification. The objective of Dr. Hirton's study was to perform an evaluation of heart rate variability collected by a wearable device to identify and predict COVID 19 and its related symptoms. The findings were very interesting.
The infection prediction portion of the study, or the ability to identify and predict infections using a device like the Apple Watch, is the findings which we were very happy to recently publish on in JMIR to report that we were able to actually identify and predict the subsequent development of COVID-19 based on these markers that we can collect from the Apple Watch, which is the device we used in this study.
Dr. Hirton and team concluded that longitudinally collected heart rate variability metrics from a commonly worn commercial wearable device, the Apple Watch, can predict the diagnosis of COVID 19 and identify COVID 19 related symptoms. Prior to the diagnosis of COVID 19 by nasal swab, significant changes in heart rate variability were observed, and demonstrating the predictive ability of the metric to identify COVID 19 infection.
One of the main takeaways from this study is that we do see changes in heart rate variability before the development or diagnosis of an infection by a traditional means like a nasal swab. And in fact, we also see these changes that occur significantly when people have symptoms. So it allows us to even identify people that have even non-specific symptoms. I always like to think about, long term, what do these type of studies mean? And at some point, hopefully in the very near future, COVID will be under control and be hopefully soon a distant memory. But what we're learning from studies like this is that we can use wearable devices, even very commonly used commercial devices, to collect very meaningful data points that give us insight into what's going on in the body. Where we say in the next few years, where are we headed? It's really using these techniques and sort of some of the principles we had published on in this paper to apply it to other diseases, other infections, chronic disease states, just the management of health, to really try to improve the management of disease and patient care in the long term. And that's my real take-home point from these sort of studies that are coming out during the COVID pandemic.
What is particularly noteworthy is that, to the best of our knowledge, this is the first study to demonstrate that physiological metrics derived from a commonly worn wearable device, the Apple Watch, can identify and predict SARS CoV 2 infection prior to diagnosis with a SARS CoV 2 nasal swab PCR test. Here at JMIR, we're honored to have scientists and physicians publishing their game changing research in our journals.